All right, let's focus now on the COVID-19 third wave, which seems to now have a fairly firm grip on a number of other provinces besides Gauteng. Yesterday, the daily new infections in the Western Cape were at 2,820. I'm joined now by Western Cape Head of Health, Dr. Cloete. Doc, thank you so much for your time. I know that you're preparing the Western Cape, but if we look back over the last week or so, the rolling average is at least sort of 2,200 cases. Does that put you firmly into third wave territory now?
Good evening, Sally, and good evening to the viewers. Yeah, we have been firmly in the third wave for the last 3 to 4 weeks. The daily average, the rolling daily average of just over 2,000 cases is what we've been seeing. Our active cases have moved up to about 24,000 cases. It's about 38% up from last week. And we currently have admissions in the vicinity of about 150 to 180 admissions each day. And our deaths have also started increasing. We're now reporting an average of about 35 deaths per day.
How concerned are you that things will actually be worse than your second wave, which is what, of course, has happened in Gauteng?
There's a few factors in the favour of the Western Cape when it comes to the size of the third wave. The first thing is we had quite a significant second wave. And if you recall, that second wave peaked towards the end of December, beginning of January. So when the restrictions came in on the 28th of December, we were already entering the peak of our second wave. Because of that high peak, we have some residual immunity, which in our case is higher than the residual immunity that was accumulated in Gauteng. Because Gauteng's second peak was curtailed because of the lockdown, because they followed us. That's the one factor. The other factor is because we've been in the second wave and it's been so big, we actually scaled up quite a lot of capacity in the second wave that we never took away. So whatever we had at the peak of the second wave, we've maintained. So we've maintained more than 1,700 staff members. We've extended their contracts. We've also added additional staff members for their vaccinations. And you also now know that we've had we got about 67% of all our staff in our department has been vaccinated. So the impact on the infections on staff is lower and we have higher staffing numbers. And then the third thing that is a little bit in our favor is because we had to go through that significant peak in December, early January, we've really tested the oxygen system in our system, both in public and private sector. And we've put additional capacity in with additional trigger systems with FROCs to be able to prepare ourselves for the third wave. So we've had a system, Sally, and the system is really about being prepared, knowing what to trigger, when to trigger, and to bring it online in a systematic way because we've been through this before.
Yeah, absolutely. Of course, you haven't been through a Delta wave before. And I mean, this is the thing. In Gauteng, I think we had a seroprevalence and immunity about 30% of the province. I'm not sure what the Western Cape's is, but even with that, you'd think, oh, well, we'll be a little bit more protected. It didn't help us much at all.
Yeah. So our seroprevalence is, there's many estimates, but we are at least above 50%
right.
In the seroprevalence. And there are certain areas in our province with much higher seroprevalence. We can already see the shape of the third wave. And so what we're doing is we're having an overlay of how our first wave, our second and third wave, we're overlaying the three. And we're already seeing the patterns that the third wave is definitely higher than the first wave. It is tracking the second wave. And we're watching it. So we are preparing to be at least as bad as the second wave, if not a little bit worse. But because we know Delta is here, we had a similar experience with Beta the last time around. We have put systems in place to scale beyond that, even if that is required from us.
So you've got a lot of plans in place, which is fantastic to hear. I want to ask you about the fact that alcohol is banned. We know that Vinpro, which is the wine growers of the Western Cape, they are desperate to overturn that ban. And we know that the reason alcohol is banned as a last-ditch thing is to ease pressure on the hospitals. Do you think that ban needs to continue to protect your hospitals?
I will take it back to what we had in December, because in December, moving towards the peak, we needed the relief of the alcohol, total alcohol restriction on the emergency centres, because all the way into December, there was a competing of the alcohol-related trauma which has now been proven by the Medical Research Council. So from where we're sitting currently, we're already seeing the impact of an alcohol ban on our emergency centres as we move into this unknown territory of a Delta kind of influenced third wave. So we definitely, as a healthcare system, are currently banning because we currently are benefiting because of the ban on alcohol, because we already see less. We understand the industry's plight. We understand that when you take something like this, it impacts the economy. And we know we need to come out of this with a much more nuanced approach, because we cannot have bans forever, and we really need to take pressure off healthcare systems at times like these, learn for the future.
You know, it's interesting because we keep asking in Gauteng, are we through the peak? Are we through the peak? And we're not 100% sure. We might slowly be sort of getting through the peak. But, you know, we know that the initial period for adjusted level 4 ends actually at the end of this Sunday, where the President told us 2 weeks ago that he would be reassessing whether to extend level 4. Do you think it's wise, perhaps, for the President to consider extending level 4 lockdown regulations beyond this 2-week period, bearing in mind that there are provinces such as your own which have not yet reached a peak?
Obviously, the President will be advised by the National Command Council, the Ministerial Advisory Committee. There will be a PCC, so there will be lots of consultation, and they will weigh up all the factors. From where we're sitting, we definitely know we're heading towards a peak. We're not quite there. The current regulations that are in place is assisting us in the preparation for mitigating what would be a peak. And I would imagine there are other provinces in the country that are still about to follow us in terms of their process for that. So I know and I trust that all of that will be taken into consideration when the final decision is made.
Yeah, and we're certainly going to keep an eye on that. Thank you so much for chatting to us this evening. Western Cape Head of Health, Dr. Cloete there.